What's the follow-up care after an ERCP?
It always depends on what the setting of the patient, what was the setting of the procedure. I'm going to divide the answer in two: inpatients or an urgent patient, or an outpatient, meaning an elective procedure. Follow-up for an inpatient is relatively easy because it's a patient that you did a procedure for an acute problem. You're going to see the patient in the hospital. You can see the results. You can look for complications or adverse events right away. When you're talking about outpatients, we always tell the patients what to look for. We tell them, if you have bad pain, let us know immediately. If you see that you're having nausea, vomiting, abdominal pain, let us know. If you have a bowel movement, you're feeling great, but you have a bowel movement and it may look black. Black, I'm talking about real black. I'm not talking about dark brown. Call your doctor. You may be bleeding. So these are things that we always tell the patients to be watching out for. There's some patients that came to us for a specific reason, and then they go back to the referring doctors, and they will take care of the long-term follow-up, and that's completely and absolutely accepted. Sometimes we see the patients back in the office to make sure that the liver function tests are going back down. If you did some type of procedure for chronic pancreatitis and you're seeing these patients in your clinic, you want to make sure they follow up in the next couple of weeks or month to make sure that the procedure was effective. Treating pain, for example, in the chronic pancreatitis, or when they have a pseudocyst or other type of pancreatic conditions, that you want to sit down with them face to face to explain what the finding is and what the next steps are. So communication is very important. We always call these patients the day after the procedure, particularly when they go home the same day, and we tend to call them also 30 days after to make sure that there's no short-term complications or long-term complications. Always, 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 we're providing our numbers for the office. We always have somebody 24 hours that can answer a phone or will refer you to a human being in case you're having problems. So if you're having a problem after a procedure, we want to hear about it. We want you to call us. And the earlier, the better.
Right. So I think it's important for the patient to understand what is the next step and what they're going to do, if and when they're going to hear from the healthcare provider that has done the procedure. So I think that's a very important part of the follow-up. In addition, oftentimes we're placing stents into these patients, and whether into the pancreatic duct or the bile duct, and whether these stents can be permanent or they can be temporary. Certainly the temporary stents, the patients need to have some idea of when they're coming back. Because as you know, if the stent is placed in the pancreas, those patients need to come back at a sooner time rather than if we were placing a stent in the bile duct, which may be several months later that they would come back for another assessment of what's going on. So pancreatic stent would come out within a week or two, whereas a bile duct stent may be a permanent stent or may need to be removed in 3 or 4 months. So I think those plans really need to be outlined. The results of the procedures, as you mentioned, certainly need to be transmitted to both the referring physician and the patient so that they understand what's going on and what the next step in that process is. Does somebody need to be referred to another specialist, whether it's a surgeon or whether it's another type of a healthcare provider to continue with their care? So I think that's clear, and those expectations should be met at the time of discharge of the patient from the endoscopy unit or from the hospital.